Welcome, medicos. Let's begin with this quote. The dream becomes reality when the plan is executed. Keep dreaming and keep executing the plan. Today we are going to start a new video series for second year MBBS. This series is for rapid revision. We'll be discussing a question-based approach towards the different topics of pharmacology. We are beginning with general pharmacology. We'll be dealing with the routes of drug administration. So this is the first part of the video. The questions will be university based so that you will know how to answer in the university exams. Let's begin. Let us begin with the first route here, intravenous route of drug administration. Here, the drug is directly administered into the bloodstream through a vein. Always make a habit of writing at least one line for any question when they ask you an exam. Generally, in these topic, they will be asking you the advantages and disadvantages of particular route, and they might ask you to contrast it between the different route with examples. Let us talk about the advantages of IV route. The first is it bypasses the first pass metabolism and have 100% bioavailability. The most important advantage. Bioavailability means it is defined as the fraction of administered dose of the drug that reaches the systemic circulation in unchanged form. That is bioavailability. What happens in first pass metabolism? The drug is administered in the body by a particular route. The metabolism of that drug to its metabolites takes place at the first site of absorption, for example in intestine or liver. This will lead to reduction in the bioavailability. So if we are bypassing it, our bioavailability will increase. Next, IV route is the quick onset of action. It has the quick onset of action and hence we can use it in emergency situations. For example, diazepam is used in status epilepticus to control the convulsions. And also IV route can be used in unconscious and uncooperative patient. It is useful in patient with severe diarrhea and vomiting. Because if there is severe diarrhea, we can't choose to give oral drug. Or if there is vomiting also, we can't choose to give oral drug. It will hamper the absorption because the drug will be flushed out. Then large volume can be infused at uniform rate. For example, IV fluids like normal saline, ringal lactate, etc., which are used in dehydration. So we can give large volume. Dose titration based on response can be achieved. Hence, we can achieve a desired blood concentration. We can titrate the dose as per the response we are getting or as per the response we want. Then irritant drugs can be administered. Since if we give irritant drugs by oral route, it will cause gastric irritation, higher incidence of nausea, vomiting, diarrhea. So for that, we will be using IV route. For example, anti-cancer drugs. Then these types of drug can be given. The drugs which are unabsorbed, like tobramycin. The drugs which can be destroyed by gastric juice, hence we will not be giving it by oral route. For example, insulin. Hypertonic solution like mannitol, which we use in cerebral edema. Then also IV route will help us to maintain a constant plasma level. For example, dopamine infusion in cardiogenic shock. Make a habit of writing examples when you are explaining it. It will fetch you more marks. Coming to the disadvantage of IV route, the first one is strict aseptic precaution is needed. It requires assistance. Then it is a painful procedure. It is less convenient. It is expensive. Then there is a risk of air embolism, thrombophlebitis, then risk of transmission of infections like AIDS, hepatitis B, etc. There is risk of getting needle stick injuries also. Then depot preparation is not possible, which is possible in IM route. We'll be learning it later. High concentration of drug can cause toxicity to kidneys, heart, brain, and liver. Coming to the examples, we can give bolus injection, for example, of ranitidine used in bleeding peptic ulcer, slow IV injection for morphine in myocardial infarction, IV infusion of dopamine in cardiogenic shock, mannitol in cerebral edema, and fluids like normal saline in dehydration. Now coming to intramuscular route, what are the advantages of intramuscular route? First, it provides a uniform absorption. It also has rapid onset of action. It too bypasses the first pass metabolism, and it is useful in unconscious and uncooperative patient. And most important thing, do not forget to mention this, depot injection for sustained action is possible. For example of testosterone. The intramuscular route. What are the disadvantages? Only up to 10 ml of drug can be given. There is a risk of local pain, abscess, nerve damage, and infection. You would have experienced local pain when you have taken tetanus injection in your arm. Then aseptic precaution is needed. It is an invasive procedure and hence it is painful and less convenient. Self-administration is not possible and it requires assistance. It is costly than the oral preparation. Coming to the examples of IM route, antibiotics like penicillin for rheumatic fever, NSAIDs like paracetamol for fever, diclofenac for osteoarthritis and rheumatoid arthritis, sympathomimetic non-selective like adrenaline for anaphylaxis, iron preparation like iron dextran for iron deficiency anemia, severe anemia, and vaccines like rabies vaccine, human papillomavirus vaccine for cervical cancer, TD, tetanus and diphtheria for tetanus and diphtheria, tetanus toxoid, and pentavalent vaccine. Pentavalent, it has 5 DPT, which consists diphtheria, pertussis, and tetanus, and hepatitis B and Haemophilus influenza B. Now coming to subcutaneous route, the drug here is injected into the subcutaneous tissue of thigh, abdomen, and arm. Let us see the advantages of subcutaneous route. It has slower but smooth absorption than IV and IM. Self-administration is possible, for example, insulin injections. Depot preparation can be inserted into the subcutaneous tissue, for example, Norplant for contraception. It has improved patient compliance. It is least painful of all the parenteral administration route. There is a low risk of systemic infection, and there are a large number of possible injection sites for multiple dosing. These are the advantages of having drugs given through SC route, subcutaneous route. Coming to the disadvantages, only 2 ml or less drug can be administered. Irritant drugs cannot be given, and the absorption is not dependable in shock. Also, relatively it has slow absorption, and there is a possibility that there will be degradation of therapeutic at the injection site, and the retention at the injection site can lead to local adverse effect, and there is greater inter-individual variability in dose. The examples are insulin, which you use in type 1 diabetes mellitus, adrenaline in allergic reactions, heparin in venous embolism, DIC. Monoclonal antibodies like rituximab is used in, at least remember this, CLL, chronic lymphocytic leukemia, and diffuse large B-cell lymphoma in adults with follicular lymphoma. For beginning, you should at least remember CLL. Opioids like morphine, which we used in cancer pain. Coming to the intrathecal route. So the drugs here is injected into the subarachnoid space. Intrathecal. Into the subarachnoid space. What are the advantages? Drug enters the subarachnoid space and it bypasses blood-brain barrier. Also, it is convenient if you want to produce high local concentration in the subarachnoid space. It is used in myelography and spinal anesthesia. What are the disadvantages of this route? Strict aseptic precaution is needed. It is very important. Good expertise is required here. It's a painful procedure and it may cause damage to the nerve root and will lead to paralysis. And there is high risk of infection. That is why strict aseptic precaution is needed. Via intrathecal route, the examples of drug are lignocaine, which we use for spinal anesthesia, amphotericin B for coccidioidal meningitis, and methotrexate, which we use for leukemia. We'll get back to you soon. Keep smiling, keep dreaming. Thank you.